Welcome to another RGVision podcast. Today we have Dr. Arauco Brown with the Pulmonary and Sleep Center here in McAllen, Texas. We all serve in the Rio Grande Valley. Welcome.
Thank you so much. Thank you for having me here.
Yeah, absolutely. Thank you so much for what you do serving our community. So, Dr. Arauco, for those who may be hearing about Pulmonary and Sleep Center of the RGV for the first time, tell us about the practice and what makes the approach to pulmonary and sleep medicine so unique.
I think the most important point of our practice is that we have the main mission and goal to make our community breathe better. Our patients in my specific area that is the advanced lung disease program that entails pulmonary hypertension and interstitial lung disease, to live longer and to have a better quality of life. And we're very proud because we have built a caring system that have been able to actually provide care that is actually multidisciplinary care for these complex diseases. That implies our interventional pulmonary system, pulmonary rehabilitation, advanced lung diseases care, our PFT lab, and we are able to take care of these issues that years ago a patient from the community would need to actually leave the valley to bigger towns to find a level of care, of world-class care that we're providing actually here in the practice now.
So many people only assume that they only need a pulmonologist if they have a serious lung condition. I believe that's a huge misconception. I'm actually a patient myself. So when should someone see a pulmonologist instead of waiting to rely solely, on their primary care physician?
It's a great question. I think somebody should see a pulmonologist if any person develop any symptom that comes out of the normal, an unexplained, cough, unexplained shortness of breath, any of these symptoms with unintentional weight loss. Unfortunately, in our community, especially in the area in which I practice, that is interstitial lung disease and pulmonary hypertension, many times the diagnosis of these conditions is delayed, not only because patients take sometimes too much time to seek medical attention, also because there's sometimes a lack of recognition of these diseases that are diagnosed with other common conditions like asthma, allergies, and we end up getting the patients in our practice when they are very advanced in their problems, instead of being able to involve us when they are early in a phase that we can actually intervene more.
Yeah. It's interesting that some people just may ignore it, I just sleep bad, I just wake up in the night, it's just natural, it's just I snore, it's a natural thing. So what are the most common respiratory symptoms that people ignore that should never be overlooked, as lingering coughs, maybe shortness of breath, wheezing, fatigue, anything like that? What are the other symptoms?
You just mentioned some of the common sleep symptoms associated with sleep apnea. I think if we, for example, sometimes we tolerate too much waking up tired, right? So waking up exhausted, feeling that our sleeping time was, not refreshing enough, is one of the most common symptoms. Snoring is one of them, as you said. Falling asleep easily during the day, in between our normal activity. For example, there are patients that sit down, to see a movie with family and they just fall asleep in seconds, or they're feeling that they're, falling asleep while they are driving in a red light. Those type of things, cannot be ignored and should prompt, evaluation for a sleep disorder.
That's interesting that you say that, because sometimes maybe people will ignore it. They just use the excuse, I just got bad sleep.
I am working a lot,
or whatever, not knowing that they potentially have an issue. Now, sleep affects nearly every aspect of our health, yet many people don't realize that they have a sleep disorder, like we just talked about. Now, why is quality of sleep so important, and what are some of the warning signs that may occur to alert somebody that something is actually wrong?
I think in general, sleeping is the healing time for our system. So we need to sleep well to recover from our, challenges from the day to begin with. Having a sleep apnea or any sleep disorder that is untreated can not only make you feel, not in your best version of yourself, can also affect your cardiovascular, health long term, depending on what the severity of the disease is. Sleep apnea, especially when it's associated with severe hypoxemia, meaning low oxygen levels, or when it's associated with chronic obesity, hypoventilation syndrome, can be, really affecting your circulatory pressures in the lung, can actually affect your capacity to tolerate surgeries well, your capacity to actually tolerate infections well, developing, pulmonary hypertension from sleep apnea is not a rare thing, especially in our extreme cases that we have seen in the valley. So I always will, prompt our patients to come early to see us if they develop any symptom.
So extreme cases in the valley. We're in South Texas. We experience extreme heat. We just talked about humidity. Is there Saharan desert, ragweed? How do these environmental factors impact the lung health for the people who live here in the Rio Grande?
It's a great question. So, the environmental factors actually play different roles in different diseases. Just because you mentioned, some of the common factors that affect pollution. Our patients with actually airway diseases, for example, our asthmatics, the allergic asthmatics or Th2 plus asthmatics, and our COPDers will suffer a lot from the variation on the air quality in the area where we live. So that way it's so important to actually have, asthmatics well controlled in the proper medications. There is a great evolve in the guidelines in asthma care over the last couple of years. And you see that many patients in the community still using albuterol, for example. Mm-hmm. That is, a medication that is not supposed to be used, that is only like a rescue inhaler.
Right.
And that do not help them to actually handle well those variations that you have said. And they are always, seeking.
They use it as if it's like a daily.
Not only that, is that these patients actually suffer so many exacerbations, and many of them actually are receiving a dose of systemic steroids that have been proved that cross the line of the average, dose that is supposed to be received by a human being in a year. That predisposes patients to obesity, diabetes, poor, bone metabolism. So it's key.
That's interesting that you say that. My son actually has some asthmatic, mm-hmm. and so me and my wife kind of go back and forth on that. But yeah, in some cases, it's there on the table. And sometimes we have to monitor. It's like, hey, this is not a everyday type of thing. It's only supposed to be used in those extreme cases. So, talking about children, they're heading back to school, and respiratory illness, it could be circulating again. So, how can families tell the difference between seasonal allergies, asthma, maybe even COVID or pneumonia, and something more serious?
That's a great question. Sometimes it's difficult, especially with children, because children have a natural capacity to tolerate things very well. A little kid can have RSV and have COVID and only have a runny nose with them. But if that little kid comes home and see grandma, and grandma is a patient that has COPD, and on top of that, unfortunately, has not the standard immunization that we expect to have, her flu shot or her RSV vaccine that is a new, they can get extremely ill, and sometimes they actually ended with us in the intensive care unit. So it's another reason actually for, have proper pulmonary care, mm-hmm. especially for our adults and patients with chronic diseases,
Yeah. So just families be aware, right?
Yes, sir.
So notice the symptoms, notice those, don't take those lightly. So what, snoring is often treated as a joke. I mean, I myself snore. But when does it become a medical concern, and what are long-term health risks associated with untreated sleep apnea?
So, untreated sleep apnea can affect you in different ways actually, and as I mentioned before, one of the problems is that if you are not well rested, I think you're not going to be performing the way that you would like or you're supposed to be in your work, in your class, in your academical, career, whatever. But, if you have severe sleep apnea and you are a patient that has some, as I mentioned before, this, chronic hypoxemia, severe obesity, hypoventilation syndrome, you really will be affecting your cardiovascular risk at that time. So our body, have a tendency to actually vasoconstrict the pulmonary circulation when there is low levels of oxygen in the lungs. And long-term, that actually make the right side of our heart to work against an increased, resistance. So you have a muscle that is basically doing push-ups the whole day and the night, probably, and that increase the overuse. It actually can induce, right ventricular failure in certain cases, can predispose you to actually develop arrhythmias, hypertension during the day. That is one of the leading causes of left heart disease. So it's really important, actually.
So one question many patients I've heard they ask is, why am I still exhausted even after getting 7 or 8 hours of sleep? What are some of the most common reasons behind the persistent fatigue that they experience?
For somebody to actually have a proper rest, you are supposed to cycle in between certain neurological stages of your sleeping, cycle, the REM sleep and the non-REM sleep. Most of the sleep apnea episode happens when we are like fluffy with no muscle tone, and that's during the REM sleep. Usually patients that have sleep apnea, especially severe sleep apnea patients, don't have the ability to cycle as they should, and because their body are trying to protect them from closing their own windpipe. And that way they just wake up and they're unrefreshed and tired.
So what are the biggest misconceptions you hear from patients about lung health and sleep medicine that you'd like to set straight here?
I think it's sleep. We need to take our sleeping time seriously. I think our performance during the day depends a lot on how actually healthy our sleeping time is. I Unfortunately, in our community, we have a very high prevalence of obstructive sleep apnea due to other comorbidities. For example, obesity, our anatomy, and it's important to actually look into this early. As I mentioned before, unrefreshing sleeps, unexplained snoring, or if our partner at night tell us that sometimes we're snoring and suddenly we are not breathing at all, and then we just need to choke to catch our breath again. So those are important alarm signs that actually should prompt any individual to look for expert advice.
Let's talk a little bit about chronic lung disease, if you don't mind. What does that mean, the chronic lung disease, for anybody who's unfamiliar with it?
No, I like the question. That's actually my area. So we handle different chronic lung diseases, and those are very important because, for many reasons. Interstitial lung disease, that is specifically what I do here, is a leading cause of lung transplantation in the United States. It entails a group of diseases with different causes that require a very specialized care. That is not a single physician care. It's a team game that imply multiple super specialties and actually players in the system and outside our system. These diseases actually usually take down your lung function year by year. And if you don't see them or you diagnose them properly, or you are not capable to take interventions that are going to change the route or the trajectory, these patients end up or dying or requiring lung transplantation. And we here, we are very familiar with those. We actually we're specialized, and we have been probably, able to obtain certification from the, Pulmonary Hypertension Association. That is one of the vascular diseases that we take care of. Bronchiectasis, and we're in the process of becoming a interstitial lung disease center also of excellence in the United States.
Wow.
Yes, sir.
So this is talk about the team and the unique value proposition for the community that you are able to provide here, when it comes to chronic lung disease.
Again, the diagnosis is very, is very difficult. As I mentioned, it implies a team. It implies that you have a state-of-the-art, a pulmonary function test lab. You need to have a pulmonary hypertension team. You need to have a network for transplantation. You need to have a pulmonary rehabilitation system. You need to have a interventional pulmonary team capable to perform cryobiopsies that we have here. So it's really a very complex, framework that we have been able to build, with my senior partners over years, actually, to reach the point that we are now. We really believe that the community in the Rio Grande Valley deserve world-class healthcare without needing to leave this city to a bigger place, and that's actually our goal. And we are providing that here in the Rio Grande Valley.
That's amazing. So prior to the team and you and everything that you are providing here when it comes to chronic lung disease, what were patients doing before?
They were always, seeking medical care with their own physicians. But when they reached the point in which those diseases were recognized, many times they will need to travel to big university centers, outside, Rio Grande Valley, to see, for example, pulmonary hypertension is such a complex. Even in big cities, it's difficult to actually find a pulmonary hypertension, center. We are not many in the United States. And we probably have one, a regional pulmonary hypertension center here. Pulmonary hypertension is a term that basically implies, increased pressure in the pulmonary circulation that really affects, has multiple causes and affects your whole health. Progressive shortness of breath can create right ventricular failure, can happen because of obesity, because of sleep apnea, because of connective tissue disorders, because of left heart disease. And each subtype has a completely different approach that required us, for example, to perform right heart catheterizations. And I think we are the only, team here that can perform these studies, and follow the pulmonary protocols and place these patients in the right therapies on time. And we're very proud about that.
Well, so what are some early warning signs that someone should not ignore when it comes to chronic lung disease?
Most of the time, the most common symptoms that will affect any lung disease, and that's the problem why many times these diseases are misdiagnosed with other common shortness of breath that is unexplained. So you have shortness of breath, and for example, your physician believes it's asthma, they start you on proper asthma care, and you are not getting better as expected. That should trigger an alarm sign. A cough that is unexplained, especially in adults, especially in males over 50 years old, should prompt, especially we have symptoms and we have been exposed in the past, for example, to working in agricultural, fields without protection, working as welders, working with asbestos, working, with tile. So there are many exposures that actually can predispose us to progressive fibrotic lung diseases that we are not recognizing. Yeah.
So if every family listening today made one change to improve their lung health or sleep quality, what would you recommend?
I think that, in general, as for any other, disease, lifestyles are the most important. I really believe on lifestyle modification, and as I always tell my patients with sleep apnea or with obesity, we have a lot of medications at this time, an alternative, but those are the cherry on the cake. So we should be able to take care of ourselves. I believe that at least 80% of our lifestyle is what we eat. Eating healthy, high protein, a lot of veggies, low carbohydrates to not deviate our metabolism in that route. Aerobic physical activity. Things like, for example, fasting, at night has such a huge impact in our weight control. Because the moment that we are actually gaining weight and accumulating, lipids and fat tissue, we will automatically start predisposing us for the development of these chronic diseases that long-term will imply, diabetes, uncontrolled hypertension, sleep apnea, and that's when everything starts to decline. So always eat healthy, do sports, be sure that this, eating healthy is not only a game of what you eat, it's actually your whole family, what you buy, what do you see when you open the pantry at home,
That's true.
So it's a big family game, a cultural change.
Yeah. So monitor the amount of tacos that we eat in South Texas. So ILD, what is ILD and why is it so difficult to diagnose?
Interstitial lung disease is a group of diseases that basically affect the framework of the lung. Okay, that is called the interstitium of the lung. The hallmark of the ILD, not all of them, but most of the ILD diseases actually create fibrotic lung disease. And the problem with this one is that there's no return. Once you lose lung function, most of the alternatives that we have for therapy now only change the angle of decline. So instead of going this, you just go like this, but you cannot recover the lung that you lost. And that's the big part. So if you are not able to actually diagnose exactly what the mechanism is, and you're not able to place this patient on the prompt, therapy that they need, you are going to be just losing lung function. And unfortunately, many of these patients in our community are referred to my practice or our practice when they are extremely advanced and they are already using oxygen, they cannot perform, they cannot work, they cannot access, transplant evaluation, and it's really sad. So unexplained cough, unexplained shortness of breath should be evaluated, early by a specialist.
Dr. Arauco, this is such an informative session. Thank you so much for your time. Anything else that you want to add to the conversation?
No, I will just to, say thank you to you, just, remind our community, as I mentioned before, that our main goal is we want our community to breathe better, to be healthier, to enjoy their lives, to live longer, to have a better quality of life. And if they develop any symptom that goes out of their normal, shortness of breath, cough, unrefreshing sleep, please, we are going to be very happy to see them here.
Thank you so much.
It's a pleasure. Thank you, sir.